Welcome to the Motherhood Alliance podcast, the podcast dedicated to empowering moms and families on their health and wellness journey. I'm Brittany Suttner.
And I'm Andrea Rinkus. Together, we're here to explore holistic approaches that go beyond conventional medicine.
Each week, we dive into topics that matter most to you. Everything from nutrition and mental health to alternative therapies and natural living.
And whether you're a new mom navigating the early stages of parenthood or a seasoned pro looking for new ways to support your family's well-being, you're in the right place.
Even better, all of our guests are local small business owners who you can actually talk to and work with. You can learn more about today's guest and connect with hundreds of other health and wellness professionals through our informative and easy-to-use directory at motherhoodalliance.com.
Before we get started, keep in mind that this podcast is for informational and educational purposes only and is not a substitute for personal healthcare advice. Please consult your healthcare provider before making any changes based on the podcast content.
Thank you for joining us on this journey. Are you ready to help your family thrive? Let's get started. Hi, we are Britt and Drea from motherhoodalliance.com, and we are excited to welcome you to a 4-episode series with Dr. Maycee Sturino, a local chiropractor who specializes in the Gonstead technique. She and her husband, Dr. Alex Sturino, own and run Genesis Chiropractic in Appleton, and they are extremely passionate about helping families take a proactive approach to their health rather than a reactive one. Since becoming a mom herself in 2024, Dr. Maycee has developed a strong love for the birth world and especially loves caring for mamas and their kiddos. Beyond her work, Maycee loves working out, traveling, and discovering local coffee shops with her family. We are excited to have her here to not only discuss how chiropractic can benefit moms and kids, but also to dive into what makes the Gonstead technique unique, tech neck, and the effects screens are having on our spines, and more. So let's jump into today's conversation with Dr. Maycee.
Hey guys, welcome back to the podcast. We're back here with Dr. Maycee. We're super happy to have you back here today.
Excited to be back.
Yeah, we had some great episodes talking about your story in chiropractic, your philosophy, and also we talked about neck tech, which was a really interesting episode. So make sure you guys go back and listen to that one. In this one, we're going to be talking more about chiropractic and how much it's just more than just back pain, because that's what most people think of when they think of chiropractic care. So let's just jump in here. So people think that they just need to come to chiropractic for back pain. Can you expand on that? Like, when people come to see you, is that what they only come to see initially, or how do you approach that?
So a lot of people initially come into our office because they have that back pain, or maybe they have sciatica with that back pain or really bad neck pain. So that's typically the reason, I would say, why people are seeking out chiropractic care. However, it is much deeper than that. So let's say we do have someone that comes in with back pain. What we do is we kind of explain how whatever incident that may have happened, maybe they picked up a pen off the ground and they threw their back out. We kind of explain it as it's the straw that broke the camel's back. So what was kind of happening in your spine could have been happening for months or years even. There could be degeneration going on. You could have a fracture that you don't even know about. And it's kind of the straw that broke the camel's back, even it's something silly like picking up a pen or changing the laundry, like throwing the laundry in the wash.
And you hear that a lot of times with people over 30, 40s.
Exactly. They're like, it's like the simplest, like silliest thing. But we always explain to patients like, hey, that issue was going on much longer. It could have been years, like I said. It could have been an unresolved injury. Maybe they got in a car accident 20 years ago and they weren't experiencing pain at the time, but now that injury never actually fully healed and now they're experiencing pain.
Yeah. What are some myths, I guess, when people come into your office, or what do you hear online, or what are some myth things that you want to bust for us today about chiropractic care?
I would say the number one thing is just that people think that they don't need chiropractic care until they're in pain. And I always kind of tell people, well, you don't go to the dentist once you already have a cavity. Like, you're already going for routine cleanings and making sure that you have good oral health. So it's the same thing kind of with chiropractic care. It's great for just overall wellness. We have a lot of patients that want to come in, just optimize their nervous system, make sure that they're functioning good. So I would say the number one myth that we usually talk about is chiropractic is not a Band-Aid approach. So we always tell patients like, yeah, even if you're experiencing back pain, let's say your back pain goes away after 1, 2, 3 adjustments, it doesn't mean that the actual structural issue is resolved. So I use a fire alarm approach in our office. I've posted about it on Instagram and stuff before. So If your house is on fire, the fire department comes, they don't put out the fire, but they just take the batteries out of your smoke detector. That really annoying beep goes away, which is great, but the fire is the major issue. So it's kind of the same thing when we talk about chiropractic and pain. So we can make the pain go away with adjusting you, but it doesn't mean the underlying issue or the fire is resolved.
That's a really good analogy.
Yeah.
Because I can see that, like, you got to come back to kind of put out the fire a little bit.
Yep.
It has to come back a little bit more,
Yeah, and that's why we try and transition like all of our patients just to like overall wellness care, and we really educate them on, hey, this is why it's important. You only get one spine. Doctors aren't taking spines out and putting new ones in. So it's really important to take care of the one you have.
And how often should people be coming in for wellness?
So that's going to be completely individualized. So a lot of like younger people, like maybe kids, once we reach maintenance care after their issues are kind of starting to resolve, we can push them out to maybe every 4 to 6 weeks. Some are sooner. Maybe they play tackle football or they're doing karate or something crazy like that. We'll see them a little bit sooner. Sometimes we have older adults that come into our office. They have a lot of degeneration. We'll typically probably see them more on a maintenance level. Maybe it's every other week or something like that. But I would say the typical adult is probably every 2 to 4 weeks, kind of depending on what works for them. We kind of go based off how they're feeling too, and like they're part of their care plan too. So it's how they're feeling and how far we can spread out those appointments.
So we talk about people think, chiropractors just for back pain. It's not, obviously. It's
Correct.
so much more. So can you give us some examples of people that you've treated or different things that you've treated that have nothing to do with back pain, or seemingly so at least?
Yeah. So one of the things that stands out, a case that stands out in my mind is my husband, Alex. He has a 13-year-old patient that presented to the clinic for bedwetting. So he was essentially wetting the bed every day of his life for 13 years.
Well, before you go further, it's amazing that the parents took him to see a chiropractor for this. I'm sure they went through a whole bunch of specialists too. I would think.
So I would assume so. So typically what most parents get told by like maybe other professionals is, oh, they'll just grow out of it. What we tell patients is they'll grow into it. So what may be a bedwetting issue now could turn into a different issue down the road. But this case stands out to me because he was wetting the bed for 13 years every day of his life, with specific care with the Gonstead 5-step protocol. Dr. Alex has been adjusting him, and he's now gone about 4 months without wetting the bed once.
Wow.
Yeah.
Wow. That's amazing.
So how often was he getting seen? Was this a little bit more of a like strategic approach of a couple times a week, or, because this isn't just wellness. This is actually trying to solve a problem.
Mm-hmm. Yeah. So typically in a case like this, it'll be more rigorous up front. So maybe it's 2 to 3 times a week for 2 or 3 weeks. And then we're seeing kind of how they're responding to care. So typically with bedwetting, what we actually see is that it'll decrease in volume first. So sometimes kids will like wet through the sheets. What we're looking for is we tell parents basically to keep like a P log to see what's different each night. So like, did the volume decrease? Typically the volume will decrease first, and then the frequency will start to decrease. So maybe instead of wetting the bed 7 days out of the week, they wet the bed 5 days, which is still a huge improvement. So we go based off small goals to reach that bigger goal of eventually not wetting the bed.
I'd love to hear another story if you have another one off the top of your mind.
Another one that I have is a little 2-year-old girl. She came in to see me because of chronic constipation. So I see a lot of kids that are struggling with constipation because of antibiotic use, because of ear infections. And I wish parents knew too that ear infections, that's another great reason to bring your kid into a chiropractor. It can help with that. But chronic constipation cases, I actually see a lot of them. So this 2-year-old was going maybe every 3-4 days, sometimes once a week. We're now about 6 months into care. So same thing with hers too. It was more rigorous up front, and now we're kind of spacing out her appointments. And she's having bowel movements daily, sometimes twice a day, multiple times a day. Parents were kind of cutting out different food groups. So like dairy, she has dairy fully introduced back in and still not having any issues.
That's amazing.
I feel like this is why you do what you do. You know, it's for these testimonials and being able to see how you're truly making a difference in these families' lives.
100%.
That's amazing. So again, staying on our kind of topic of like things beyond the back of what you support, what are some other signs or symptoms that would indicate that someone should definitely be seeing a chiropractor?
So we kind of covered the bedwetting, constipation. So like the opposite of that too, like maybe someone has chronic diarrhea, chronic headaches, migraines. There's so many different types of headaches, and they correlate with different areas of the spine. So for instance, maybe someone's having hormonal headaches and we actually find something in their lower back because those nerves supply the reproductive organs. So maybe that's what's going to help their headaches versus maybe they're having tension headaches. So we need to adjust the upper mid back, maybe the neck. There's so many different types of headaches. And then, it's just a lot of things that people don't think about. People will ask me who's a good candidate for chiropractic care, and I tell them anyone with a spine.
Yeah, no kidding. Yeah.
Anyone with a spine, because the spine houses our nervous system, which controls every organ, tissue, gland, every bodily function. So I try and tie like most things, if not anything, back into chiropractic care and how if we're helping you overall function better and your nervous system function better, that can help many different things besides pain.
And I'm hearing you too, like there's some things that like the constipation story or the bedwetting story where chiropractic care is actually directly affecting and helping these conditions. Mm-hmm. I would also say like, even if you're going through, cancer treatment or whatever else, chiropractic care isn't going to cure your cancer, but it's definitely going to support your function.
Yeah. So we always tell people chiropractic care is not a cure for anything. It's just helping your body heal because your body is made to heal itself. It's a self-healing organism. Just like if you get a cut, you get a scab for a reason because the body is made to heal itself. So by getting adjusted and optimizing nervous system function, it can help all the bodily systems heal and just function better.
That's good enough right there.
What about things like anxiety, depression, chronic stress? I mean, I feel like everybody is chronically stressed these days, but taking it to another depth of maybe depression, things like sicknesses. I'm just trying to think of like things that so many people are struggling with. I'm assuming chiropractic is going to help just because of what you just said of optimizing the whole body.
Yeah. So we look at the autonomic nervous system is what it's called. So it's the parasympathetic and the sympathetic nervous system. I explain it to patients as the gas and the brakes in the car. So the gas is the sympathetic nervous system. The brakes is the parasympathetic nervous system. And it's in different regions of the spine that we adjust to get a different response. So let's say someone has that anxiety, for whatever reason, whatever may be causing it, they're pretty high strung. They're in a high sympathetic state. So we're looking at regions of the spine that correlate with a parasympathetic response to help their nervous system kind of calm down. Because ultimately, when you're driving, you need an even balance between the gas and the brakes. It's the same thing with your nervous system. When we go throughout life, we want an even balance between the gas and the brakes to be able to adapt to our environment.
Makes a lot of sense.
You have such good analogies.
Yeah, you do.
Thank you.
That makes total sense. Sometimes we do have to hit the gas and we need to be able to react quickly to something.
Yeah.
But I would hope that more of our life, and this maybe wouldn't really make sense with the car, is that we're in control and a little bit more in that parasympathetic and not living in a state of stress.
Yep.
Yeah.
Well, it's all about balance because our environment is ever changing. If there was a bear in the room, we need our fight or flight to kick in. We don't want to be sleepy versus when you're trying to go to bed at night, you don't want to be super high strung. So it's really just balance and adapting to our overall environment because it's always changing.
Well, and I think that, we talk about chronic stress and we could probably go into a whole nother episode about all this stuff too. But I mean, like when you're always stressed out, when you're always like on, people can't really take that off. And so learning to not just jump into that sympathetic nervous where you're like, I got to get into it, but then learning how to also be able to quickly switch back into that parasympathetic, that's where a lot of people are missing. And I think that, chiropractic care is going to be part of that, but, learning how to deal with that in your lifestyle and everything else. So
for sure.
Yeah.
You know, another thing that we see in our office too is when we're looking at our patient's skin, and like I said in a previous episode, we're looking, is there any acne blemishes? Are they sweating excessively here versus do they have dry skin here? We're also looking at different skin conditions because the nervous system is also controlling like the sweat glands and everything like that. So your central nervous system and your skin actually develop from the same embryological layer in utero called the neuroectoderm. So we kind of look at it as a skin is almost a window into our nervous system. So being able to see different skin conditions and stuff like that can also give us an idea as, hey, what's going on with this patient internally rather than just looking at it as an outward approach.
I didn't realize that. That just like gave me a little bit of a light bulb moment. That's pretty cool.
Yeah, and that's also why we use the scope on every visit because we're running it on the patient's skin up and down their spine, and it's telling us where the excess heat is because again, the skin is a window into the nervous system, and it's telling us, hey, the nervous system is stressed out here. We need to take care of this.
I mean, I'm thinking about rashes. I'm thinking about eczema. I'm thinking about all these different kind of unique skin conditions that can be caused from viruses and like all these different things. Go a little bit deeper into this on,
okay,
like if somebody came in with a rash, is that something that's going to help you, or is that kind of off and different type of scenario?
Sure. So let's talk about shingles. So most people know what shingles is. It's a dermatomal rash, which is what we call it. It's along a dermatome. So basically one strip of skin. It usually starts where the spine is and it kind of wraps around the ribs when it's in that area of like the mid back or wherever it may be. So we can actually trace that back to which spinal segment it's starting at because that virus is housed in what's called the dorsal root ganglia, which is it's the nervous system. So the spine is protecting that. So when we adjust those areas too, we have seen rashes like shingles clear up quicker than if maybe you weren't receiving chiropractic care because again, it's all related to the nervous system. So rather than using like a different rash cream, we're trying to find like the root cause of why this rash may be happening. And the window is the nervous system.
Now, I've seen these posters in chiropractic offices of where it's like, okay, this area of the spine kind of helps control this area. And you've mentioned this about like,
yep.
I'm going to adjust here because that impacts the reproductive area.
Mm-hmm.
Is there kind of an immune section of the spine? So I'm thinking about like a full body rash if somebody had that, or even just like sicknesses. If somebody is sick and they're coming in, is there kind of a specific area of the spine or is just a full adjustment going to help with immune function?
So it's not typically like just a certain specific area of the spine. It's really just helping them function better overall and helping the nervous system function. So we have a quote that Gonstead chiropractors like to use. It's find it, accept it where you find it, fix it, and leave it alone. So sometimes like if I have a headache patient and the only thing I'm really finding is their low back, I just have to accept it where I find it. I'm like, okay, this is where the subluxation is. This is where the body's telling me that I need to adjust. I'm going to accept it where I find it, correct it, and just leave it alone.
See what happens.
Exactly.
See what the result is.
Exactly. Mm-hmm. And that's also too why Gonstead chiropractors, we don't adjust too many segments in one visit because that's kind of like a shotgun approach where we take more of a sniper approach. So we may adjust less things each visit because let's say you come in with low back pain, I adjust it and it's 80% better when you come in for your next visit. I can look back in my note and know exactly which segment I adjusted. So I know, okay, that's what made you better. Whereas if I adjust, 7, 8 different things, I'm kind of like, okay, well, which one of those adjustments exactly helps? So it's kind of a shotgun versus sniper approach when it comes to like precision and specificity.
That's really interesting.
That is fascinating.
I do want to switch gears a little bit and talk about the role that chiropractic plays in supporting an athlete, because athletes, and you were an athlete, we talked about this in the first episode, how you did a ton of sports growing up, but then you were also into powerlifting. Athletics do come with injuries, maybe not always to the spine, but other areas of the body as well. So what kind of a role does chiropractic play in this for athletes and even people who are just working out at home? A lot of people are scared of like that athlete word. I'm not an athlete. Well, actually, if you move your body, you are an athlete.
Yeah.
But do you also help with like injuries of areas outside of the spine?
Yeah. So we do a lot of extremity adjusting in our office. So extremity is anything but your spine. So like a shoulder, elbow, wrist, ankle, knee, even your jaw for people that are experiencing TMJ, and different symptoms like that. We adjust all those different areas too, based off kind of what we're seeing with our analysis. And a lot of patients do end up having extremity issues too, and the body's all connected. So it could be coming from the spine. It could be coming from an extremity. We've seen patients that have had low back pain because of a knee issue, and their knee just needed to be adjusted. And that's actually what helped their back pain. So it's all interconnected. So that's why we take a holistic approach in looking at the patient's whole body.
Well, thank you, Dr. Maycee, for joining us and kind of helping to unpack all of these benefits beyond the back, right?
Mm-hmm.
I mean, it really is kind of breaking these myths that people have about chiropractic. I do want to mention that Dr. Maycee is offering $50 off an initial exam for someone who mentions that they heard about her on the podcast. In our last episode, we also did talk about your free spinal wellness classes that you hold on the first Thursday of the month. So if you're interested in that, you guys can go back and listen to episode 2. But do you also offer like a free consult for someone who just has questions, maybe a little bit more personal questions? They don't want to be in a group setting and have a little bit more one-on-one?
Yeah, exactly. So we offer complimentary consultations. So whenever we can kind of book that into our schedule, we can do 15, 20 minutes. Somebody will just come in, we'll give them an office tour, kind of explain to them how our office works, how specifically the Gonstead method works, and then they can feel free to ask us any questions they may have regarding future care.
Okay. That is very helpful because I think a lot of people, especially if they're just learning about chiropractic, they're really nervous.
Yeah,
So
100%.
Yeah, a great way just to meet you and feel comfortable and be brought into your family.
Yes,
right?
for sure. Mm-hmm.
Awesome. Well, we've had 3 awesome episodes together. We have 1 left and we can't wait to jump into this episode. The next one is going to be about babies, the kiddos and the mamas, pregnancy, postpartum, all of that jazz. So if you know anybody who is trying to conceive or is currently pregnant or has kiddos themselves, this is going to be a great episode for them to listen to and you as well. Stay tuned for that one. If you enjoyed this episode, would you consider leaving a rating or review or sharing it directly with a friend who could benefit from the information? We know that you're a busy mom or caregiver, and our goal is to make your life easier by bringing tips and tricks directly from experts into your earbuds. By sharing this episode with someone you love, you can play a critical role in helping to make their life easier as well. We appreciate your time and thank you for being a part of the Motherhood Alliance family.